Hi everyone, my name is Gil Barzilai and I'm honored to be a speaker at the upcoming EBA Symposium, which will take place on September 14th and 15th in Providence, Rhode Island. Usually I talk about researching Chinese medicine, but Mel has challenged me way back to my 13 years in a pharmaceutical company. The idea was that as a collective rather than individuals, we take a closer look at what drug companies do in order to promote their products and agenda and see what we can take into our own profession in order to make acupuncture a first-line treatment or integrated into Western medicine. Drug companies invest a lot of money in sales and marketing, and most of the investment goes to creating awareness and educating physicians, patients, and their immediate circle. This is done through advertisement, public relations, websites, seminars, books, lobbying, and other tips and tricks. We need to look into each of these activities and see what may be useful and cost-effective for our own profession in order to invest and create demand for acupuncture. For example, currently, most patients who suffer from lower back pain will think of taking Advil, Tylenol, or even worse, go to the doctor for an opioid prescription. How can we change perception so that acupuncture is one of, if not the first treatment option that comes into their mind? How can we be more proactive and drive perception rather than reactive when we see an article that says that acupuncture is no more than a placebo? Well, here's just an example related to awareness. One of the ways to create awareness is through awareness campaigns, such as Breast Cancer Week, World MS Day, and others. Not ignoring the good side of it, pharma companies did not invent it. It was actually created by patient associations. However, they certainly know how to use them as a platform to promote awareness for a disease so as to increase the number of patients diagnosed with the disease or to increase demand for their drug. For example, looking at MS, 30 years ago, there were about 250,000 patients around the world. Now we're talking about more than 2 million patients around the world. So what has this got to do with our profession? Well, I have seen in several countries acupuncture awareness days or a week. The problem is that acupuncture is not a disease, and therefore this usually generates little or limited interest. Perhaps a better way would be to join the war against a certain disease and offer acupuncture as one of the treatment modalities to fight it. Talk to the organizations, show them the evidence that we have for acupuncture's efficacy, and we have plenty of it, and include acupuncture as one of the treatment options. We are now in the midst of the opioids crisis, and this is a great opportunity for us all because some organizations may especially want to appear more responsible and hopeful for their patients by providing information on pharmacological as well as non-pharmacological options for treatment of a certain disease. And this investment will definitely take us far more in terms of publicity. I will be going through plenty more visual examples, so I hope you will join me and 8 additional amazing speakers, together with hundreds of therapists from around the world for the first EBA Symposium. See you there.